Venous thromboembolism is a life-threatening disease worldwide. Nearly 3 billion people passed away about VTE and the complications today. In the USA alone, 900,000 patients get hospitalized each year, and many more become permanently disabled after this treatment. And eventually, millions are suffering about deep vein thrombosis and pulmonary embolism complications. And this patient treatment only with therapeutic anticoagulation, elastic compression stockings, and the elevation. And one necessary is one treatment, but simply this is not sufficient for preventing post-thrombotic syndrome. They all suffer for swelling, skin ulcers, low quality of life, and chronic pain. And somebody taking care of the patients, but the patients often told us we have to live it, nothing can do about it. We have very good solutions for that, and Dr. Keith Sterling and Dr. Mark Karzia told us the XSPTS trial result is very impressive, especially for the chronic femoropopliteal deep vein thrombosis. As we know that chronic thrombus is disaster disease. You cannot treat it surgically, you cannot treat it endovascularly till now, but now we are treating them with EKOS pulse treatments. After EKOS, we have seen a much more easy, softened vessels that comply and better respond to balloon angioplasty, and all the femoral veins being patent after treatments. And most importantly, the patient quality of life is improved and the ulcers are healed. Treatment of chronic, acute or chronic deep vein thrombosis has been changed. We had a shifting paradigm of treatment because 10 to 15 years ago, we only treat the patient with anticoagulation. But we all know that for acute proximal deep vein thrombosis, just for anticoagulation is not enough for this patient for preventing post-thrombotic syndrome. That's why we treated patients for endovascular way, for angiographically. And at that point, we have a very good, powerful tool for EKOS. Only for overnight infusion, all the thrombus is gone. And then we completely recanalize and prevent for post-thrombotic syndrome for that patients only with just needle point.